Great. You ready to learn about the medications that are used to help treat the inflammation of Crohn's disease? Now, you may already have tried several or even all of these, but reviewing them may help you better understand their potential roles in your ongoing treatment. And since there's a lot of ground to cover here, make sure you have about 10 minutes or so to listen. Let's pass it on to our GI nurse, Joan.
There are 4 major types of prescription medications used to treat inflammation. These are 5-aminosalicylates, or 5-ASAs, corticosteroids, or steroids, immune modifiers, and biologics. We'll also go over the antibiotics you may be prescribed to treat any infection that can accompany periods of inflammation in Crohn's.
Now, drugs are used in 2 ways for Crohn's. When you're sick, they're used to help get the disease into remission and also to help stop the disease from flaring again. Your doctor may suggest one or a combination of medications to help reduce your Crohn's symptoms during a disease flare or to prevent complications and help keep you in remission. What I like to do with my patients is to get them to describe their symptoms so I can understand what they're experiencing and review the medications they've been using to see if they're well managed or if they might benefit from a change of medication. No matter how your doctor approaches treatment, it's a good idea to talk about differences between drugs, especially their benefits and side effects. That way you'll know a bit more about what to expect from the medication.
And to get the most out of your therapy, be sure to always use your medication as directed by your doctor. Now let's begin with the 5-aminosalicylates. Also called 5-ASAs, these anti-inflammatory drugs are typically used to treat mild Crohn's symptoms. They are daily medications you administer on your own, most often taken orally, but they may also come in rectal formulations. The 2 generic names are sulfasalazine and mesalamine, which, I'll admit, take a little practice to say right. Sulfasalazine can lead to a number of side effects, including nausea, vomiting, heartburn, and headache. Mesalamine may also cause these side effects, as well as diarrhea. Now, let me just mention here that the side effects we list off for these medications are only possible side effects. What I mean by that is you shouldn't expect to get them, but you should know that you might get them so you aren't confused if one or more of them show up in your life. But don't worry about getting all of them when you start your medication. That's not really how it works. Okay, let me do the corticosteroids now, because I have to run. Now, we call them steroids, but they're not the kind that will turn you into a bodybuilder. Those are anabolic steroids. Well, these steroids are used to treat inflammation. Some steroids, like prednisone and budesonide, can be taken orally or rectally at home, while others, such as methylprednisolone, can be given with an injection by a healthcare professional. These drugs are taken daily during treatment. Most steroids are systemic, which means they affect your whole body and not just the site of your Crohn's inflammation. They are usually used to treat moderate to severe symptoms and are not recommended for maintenance therapy. These are pretty effective drugs, but they do have significant short and long-term side effects that I make all of my patients aware of. Short-term side effects can include mood changes, as well as a redder and/or rounder face, swollen ankles, a bigger appetite, and weight gain, less need for sleep, acne, blurry vision, and night sweats. I know, it sounds like a lot, but remember that not everyone gets these side effects, and not all at once. Long-term side effects can include easy bruising or thinning skin, bone loss or osteoporosis, eye problems like glaucoma and cataracts, and muscle weakness in the legs or upper arms. Again, don't expect to get these, but just know that these side effects are possible. That's it for me, Doc. Call me later if you need more help.
Great job. Now let's take a look at immune modifiers and biologics. Immune modifiers are a type of drug that reduce inflammation by helping to control the part of your immune system that is misbehaving and is responsible for the inflammation. They may be used in combination with steroids during a flare. They are also often used to help reduce the patient's need for steroids and to maintain remission, which you'll remember as the period in your life where you live virtually symptom-free. Some immune modifiers are swallowed, usually daily, while others are injected either at home or by a healthcare professional. The most commonly used immune modifiers for treating inflammatory bowel diseases are azathioprine and 6-mercaptopurine, or 6-MP, and methotrexate. Since they reduce your body's ability to fight infections, in general, you should avoid contact with sick people and to wash your hands frequently, especially before eating. The potential side effects of these drugs include nausea, an upset stomach, fever, and rash. There is a chance that more serious complications could develop, including pancreatitis and nonspecific abdominal pain. So anyone taking these drugs will have testing done for blood and liver issues. Also, there's a slight risk of developing a type of cancer called lymphoma while taking immune modifiers. Methotrexate is commonly used in rheumatoid arthritis, but is also proven useful for Crohn's patients. It has both short and long-term side effects while it's doing its job. In the short term, it can cause nausea, fatigue, and diarrhea. Over the long term, it can rarely lead to scarring of the liver. Women are told not to get pregnant while on methotrexate. Okay, now let's turn our attention to biological response immune modifiers, or biologics, the latest generation of medications for treating Crohn's. As of the making of this DVD, there are 2 biologics indicated for Crohn's in Canada, adalimumab and infliximab. These 2 biologics, also known as TNF-alpha inhibitors, are both used to reduce the signs and symptoms of the disease, as well as to induce or bring on remission and maintain it. Biologics have been shown to be effective in treating fistulas and are usually prescribed to people who do not respond to what we call conventional therapy for Crohn's, the treatments we discussed earlier. Biologics are currently given by injection, either just under the skin, called a subcutaneous or sub-Q injection, or by infusion into a vein, called an intravenous or IV injection. The sub-Q injection is given every 2 weeks by a healthcare professional, or you may inject it yourself at home after proper training. The IV injection is given in 2-hour sessions every 8 weeks at an injection center under the supervision of a healthcare professional. Common side effects for biologics include mild skin reactions where you got the injection, nausea, stomach pain, cough, sore throat, upper respiratory tract infection, rash, and headache. You should know that biologics may make it difficult for you to fight off infections because they suppress your immune system. Be sure to tell your doctor if you have a history of infections or if you develop a fever or infection while taking a biologic. Seriously, it's really important. Your doctor should check for signs of infections such as tuberculosis and hepatitis B before prescribing a biologic, but you can help by thinking about your history of infections. Other serious risks of biologics include a rare risk of lymphoma, MS, eye problems, and heart problems. Speaking of infections, we've come to our final medication of this section, the antibiotics. They aren't usually used to treat Crohn's in general, but antibiotics such as metronidazole, ciprofloxacin, and others are used to treat intestinal infections and also for complications such as an abscess. They are also helpful in perianal and colonic Crohn's disease. Now to the side effects. Metronidazole, which is one of the most commonly used antibiotics in Crohn's, can cause nausea, headache, loss of appetite, and a metallic taste in your mouth, which is kind of odd if you ask me. For those of you with a tongue piercing, you'll already be used to that side effect. More serious side effects, which are less common, include numbness and tingling in your hands and feet, muscle pain, and weakness. If you were to develop numbness or tingling, you should notify your doctor, as this may mean you need to stop taking your medication. Ciprofloxacin can cause side effects including nausea, vomiting, headache, and rarely tendon problems. Phew, that's it for medications that can help treat the inflammation of Crohn's. Of course, I hope you don't have to try them all, but if you do, at least now you have a general understanding of what they do for Crohn's and what they can also do on the side. Now go take a nap and let all this information sink in. I know I'm going to. I'm exhausted. But if you're up to it, how about checking out more severe Crohn's, more severe symptoms? And of course, there are also other choices.